If you guys can do me a huge favor, type in the chat box where you're from and how long have you been dealing with this wonderful disease. That would be very helpful. All right, I hear typing, but what's weird, oh, there we go. Now I'm starting to see. Northern Ireland, 6 months. So sorry to hear that, Eileen. Eileen, have we talked before? You could nod, I could see you, you could nod your head, you don't have to type. Save yourself a couple minutes.
Yes, yes.
Okay, I was gonna say your name, you did look familiar. All right, hello, I'm Annie White from Northern Ireland. What is this? Minnesota can't do video, only audio today. 10 months with this due to 3 herniated discs, they say in the MRI. Susan, what part of Minnesota are you in? Because I grew up in northern Minnesota. All right, trying to keep Malacca. All right, way up Lake of the Woods, Lake Mille Lacs. All right. So if I can have everybody who's not muted, mute yourselves just so that Wales in the UK, very cool, since January. So Susan and Carol, if you can mute yourselves just so that we can not have some noise in the background that's not needed, that would be great. Let me see, Carol, if I can help you out with that. Yeah. Or you can just sit really, really quietly.
I will.
Wait, there you go. I just muted you. Okay. So guys, welcome. I have not done a class with sciatica clients in, got to be 3 years now, but I decided, all right, there's got to be a way for me to connect with people. And just so you know, this is being recorded and only the people who have signed up for the course are going to get this recording. So if you are someone who doesn't like your face to be seen, feel free to pop the video off. That's totally fine. But once we do questions and answers, if you could please put your camera back on. If you turn it off, that would be great. Just wanted to cover what I'm going to be covering today. I think hopefully you guys read through and what the agenda was, but going to basically cover the questions of number 1, why are you still suffering? And you guys are all going to look and go, how the heck will you know? But been doing this long enough to know I can tell you why you're still suffering. All right. Number 2, why most treatments are merely Band-Aid approaches to the problem. And like I said, having been a physical therapist for 31.5 years now, and over the past 15 years, focusing on a new treatment technique that has been phenomenal for my sciatica clients, I can tell you why and how a lot of what you've probably been doing and a lot of things of what you've heard and a lot of things that are on the internet and that you find on Google and YouTube are merely Band-Aid approaches. Do you guys hear more noise coming through my mic or do you just hear my voice? Everything's good? Okay, because I got construction workers outside the window and it's really loud in my left ear, but I'm glad you can't hear them. After we talk about why what you're doing is merely a Band-Aid approach, we're going to talk about the best exercises to do for this condition. And you're all wondering, well, if we all have different conditions and different reasons, how do you know? I'll tell you and you'll be able to understand by the end of this how I know and why I know. Then we're going to talk about 3 things that are required for everybody's body to heal from any type of musculoskeletal problem, but very, very appropriate for sciatica. And then we're going to talk about what you should look for in a healthcare provider. Because obviously, if you guys are on this call, I'm assuming you haven't found it yet, because otherwise you wouldn't be interested to hear what I have to say. So let's get started, because I want to try to leave some time for questions and answers at the end and maybe show you an exercise or 2 that may help or may not help depending on what's going on. But the reason why you are all still suffering and not getting the relief you need is real simple. You haven't had the right treatment. It's not any of your faults. And I always try to tell people, look, you guys are doing what you're told, whether it be from your nurse, your doctor, your chiropractor, your physical therapist, your acupuncturist, your trainer. everybody's doing, I'm assuming everybody's doing what they've been told and trying to get out of pain. And the reason it's not is because you have not yet found the right exercises, the right protocol, the right things to do for your condition. And another reason is if you're doing exercises and you're not seeing consistent benefit from them, you are doing the wrong exercises for you. And I can tell you that there's nobody out there who's trying to give you the wrong exercises. I guarantee you they've been giving you what they've taught, what they've been taught, and what they have felt has worked the best for people in the past. I did that too for 15 years. And I don't know if many of you know my story, but through the first 15 years of my career, I was helping 15 to 20% of my sciatica clients. And they thought I was amazing and they were spreading the word of how great I was. But that left 80 to 85% of people who just were not getting the relief. And they were probably doing a lot of what you guys are doing if you're doing exercises, stretching the painful side, trying some nerve flossing or nerve gliding, trying to do the pelvic tilts and the bridges and the core strengthening and the press up activities, all the sort of what I like to refer to as generic exercises, because if you've been to a primary care doctor or most doctors when they're dealing, and if you see me looking off to the side, I'm just looking to see if anybody else is signing in because we have 1, 2, 3, 4, 5, 6, 7, 8, 9. That's not bad, 9 out of the 12. So if I keep looking over here, it's because I'm thinking someone's going to sign in and I want to allow them into the group. The exercises, if you've ever gone to a family doctor, primary care physician, GP, whatever you call them in your area, and they say, oh, you got sciatica, here's some exercises to do. If you guys have ever had that situation, you're getting generic exercises that are for back pain patients, but you will find that half of those exercises may work for you. The other half will definitely not and be more painful. I don't know if anybody's experienced that, but I used to actually have generic handouts too for my back pain patients and my sciatica clients because I was giving them the press up activities, the core strengthening, the pelvic tilt, the bridges, the cat camel or the bird dog, whichever you've been taught it as, the hamstring stretches, the glute stretches, all the basically what I like to call generic exercises that are awesome when someone has a minor type of glitch in their low back or their butt or their hip. But when you have sciatica and the nerve is injured and you keep trying to do the same exercises over and over, which are stretching and pulling and digging on that nerve, you're basically just irritating something that's already irritated. Okay. The other reason you're still suffering is you may be one of those people who's depending on gabapentin, some type of medication, some type of bracing, some type of creams, ice, heat, TENS units, and those things all feel great. And I don't have anything against people taking medications to get out of pain. The only problem is if you're depending on that medication to heal you, unfortunately, medications for sciatica do not heal the problem. They may take a little bit of the symptoms away. For a small percentage, they may take all the pain away, whether it be an anti-inflammatory, muscle relaxer, pain medication, a steroid injection, an epidural injection. But those things are basically temporary fixes because while they're in your system, they're going to work. The big caution I always tell people is if you've taken an injection and gotten relief, taking medication and getting relief, if you do things while you are having that temporary relief that you normally can't do or couldn't do because it was too painful, you're probably aggravating the problem further without realizing it because your symptoms are being masked by that medication. Does that all make sense? For you four who are on, I could see the heads nodding up and down. Good. And if my sound goes out, if there's a problem, I'm going to count on Annie and Carol and is it Jamu? That's what's on your screen. I know that's probably not your name. Okay, you're muted, so I can't hear you.
Janet.
Say that one more time.
Janet.
Janice?
Yeah, Janet.
Janet. Okay, gotcha. Janet and Eileen. So you are the four that I can see. So if my sound goes out or something, just do something so that I know something's up. So So why are most treatments merely Band-Aids approaches to the problem? I already talked about medications. They are going to give you a false sense of security if they calm down your symptoms. A lot of people wear braces for their back thinking that that's going to heal them. And even though it may take some of the pain away, and again, I'm not against bracing, just like I'm not against medication, but if you're depending on the medications, if you're depending on the braces, wearing a brace for a prolonged period of time will basically weaken up the muscles that you're needing to hold you in that position. And so you are looking at a longer term healing, because even though it may feel good, your muscles are going to get weak. You take the brace off and guess what happens? Now you have less stability in the area that you need it in, and you're going to start requiring that brace just to function. So if you're someone who's wearing a brace for security and pain relief, please do it sparingly and very cautiously, so that you are not making your muscles depend on the brace in order to keep you secure. People use a lot of creams, whether it be Icy Hot or the Tiger Balm or the Voltaren cream that's oftentimes prescribed. Those things are great, but you're rubbing it on your skin, you're getting a great skin reaction, which can feel really good, but it's not doing anything deep down for the muscle imbalances, for the underlying problem that's causing the sciatica. Injections are the same thing. I covered that above with medications. And like I said, I'm not against injections. Some people get an injection and for 6 months, they're great. And I don't know why it doesn't last more than 30 seconds for some people and up to 6 months to forever for others. But I do know the studies that have come out that have shown whether you get injected with a steroid, a analgesic, or saline solution, the outcomes were pretty similar overall. So I don't know whether it's people are just believing the fact that they're feeling better, and they do feel better because our brains are amazingly powerful tools, or whether the medication is actually having an effect, which is sort of negated when they did the saline, and the saline had the same type of outcome as the medicated injections. So just be cautious whenever you're feeling good and it's due to a medication or something that is not necessarily healing your body. Does that all make sense? Next, the best exercises for you to do for your condition. First and foremost, ones that are not painful. And I actually just put out a video about, everybody sees that it says the 10 best exercises for sciatica, but they don't read the small print above it. And it says, are there 10 best exercises for sciatica? And the answer is there aren't. And here's why. Don't let that be frustrating, because there's hope on the other side of this. Everybody's different. Whether your symptoms are coming from a herniated disc, a bulging disc, your piriformis, the SI joint, a hip issue, a gluteal issue, whether it's from stenosis or arthritis or a ligament in your back, it doesn't matter to me, and I don't mean that in a cold way, it doesn't matter where your symptoms are coming from or why they're there. But if you're doing an exercise that's causing pain to it, that is akin to me trying to heal this side of my head if it's sore, doing this to myself, going, hey, how come that's not making you feel better? It's because you're pounding and irritating a problem even further. So you're basically irritating something that's already irritated, hoping that the irritation will calm down. And it won't, just simply because you're irritating it again. But the caveat to that is, when I'm pounding this side of my head, when I stop, now I'm comparing the pain that I'm feeling right this second to how it was when I was pounding. And so it actually feels like it's a little bit better, which gives you a little bit of false hope, because what happens 10 minutes, an hour, or 2 hours later, it comes rushing back with a vengeance because you've irritated it. Does that all make sense? So doing exercises that cause pain is never good, especially with sciatica. And from my perspective, for any problem that you're having, if you're causing pain to the, if you're increasing your pain or causing pain to the area where your problem is, it's probably not a good exercise for you. But the best exercises for people, number one, are those that balance out imbalances in your body. And what I mean by that is, everybody's body compensates when they have any type of pain, soreness, stiffness, tightness. Since we're talking about sciatica, most of the time it's on one side. Very often for people, it can be both sides. So don't be discouraged if both sides are painful, because, hey, that just means your problem is more central than most people's, because most people have a bulge or a herniation or a pinching of one of the sciatic nerves. But if you have it on both sides, it just takes a little bit more investigating to find the right exercises for you. But what happens is, anytime your body has any type of pain, let's say it's your right-sided sciatica, every step you take with that right foot is going to be compensated for. And it's easier to explain it like this. If I had a sprained right ankle and I was walking, most people have seen people walk with a sprained ankle and they're doing this because their body's compensating for that right ankle. And what happens is the bottom part of that right leg is tightening down, locking in place so the ankle does not get further injured. It does not get injured more. All right. So those muscles in the bottom part of that leg are put out of commission. In addition to that, you have pain, so your body's shifting to the left side. So in order for you to function and move, your body has to compensate. The entire body's compensating for that ankle, which means this shoulder's pulling like this side is pulling like this, and you have all this abnormality, these imbalances in your body, right side versus left side. And as you can see, that just puts stress on the body. So every step I take, my body's fighting against itself. And as you know, when you have extra stress, extra tension in your body, the area that is going to take the brunt of that is the most susceptible area in your body, which is the injured part, which is your sciatica. So when you are trying to function and push through pain, your body's fighting against itself, aggravating the problem further. So that's why I always tell people say, hey, is walking good for sciatica? I go, that all depends. If walking is painless for you, absolutely great. If it's painful for you, do not push through it, because you're just basically doing this to yourself, wondering, okay, how come it's not getting better? So exercises that balance out the right side, left side imbalances are going to be key for anybody who's dealing with sciatica, because if you can calm down the extra tension that's going through your body has a chance to heal. You're putting your body in a better position to heal. So I already talked about, you don't want to do exercises to the painful side of your body, especially if they aggravate the pain further. So my bottom line is, I tell people, look, you got to find positions that feel good and continue to do that. You've got to try to find movements in your body that feel good and don't aggravate your pain, and continue to do it. So what feels good is good. What feels bad is bad. And if you can find where your body's imbalances are and balance them out, that is ideal. And what I learned in school and what changed the way I do things about 15 years ago is this. I was taking a course by this gentleman who had been a mathematician and a leading mathematician in the country before he decided he wanted to be a physical therapist. And he just started explaining, he goes, don't you find it weird that when somebody comes in to a physical therapy clinic or any medical clinic or any stretch gym or any dealing with any professional who deals with the body, if someone comes in with a tight hamstring, what do we do to loosen that? And I said, well, we generally stretch it. He said, so you're taking something that's tight, you're making it tighter, hoping that the result will be that it makes it looser. And he said, when does that happen anywhere else in life outside of the body? And it really doesn't, because if I'm assuming everybody's tried to open a jar that was tight or try to unscrew a screw that was tight, and it never crosses your mind to go, hey, if I just make this a little bit tighter, that's going to loosen it up for me. It doesn't work like that. Life does not work like that. So why do we think that when we take something that's tight and pull on it, make it tighter, that it's actually going to loosen up? It doesn't work. And as he started explaining how we've got it wrong in physical therapy and how we need to be looking at the opposite side of the body, because if this is painful, why do you want to continue to cause pain and force it and force it and force it? Because what we learn in school is, hey, you know what? If things are not moving right, we need to figure out what the barrier is, fix that barrier, and help that person to move fully. So we're always moving and doing things on the restricted side of the body, trying to force it, trying to move the joint around to gain more motion, trying to do everything we can, loosen up the muscles so that things will free up. And what I've learned over the last 15 years is when you work the opposite side of the body that's loose, that's comfortable, and that's easy, that generally calms down that tension in your body because your body doesn't have to guard against and doesn't have to fight against the pain and restriction. It can move freely. And when you're doing that, that actually increases the mobility, decreases the tension on the other side of the body. Does that make sense to everybody? All right, good. So moving on, and if you guys have questions, you can feel free to put them in the chat so you don't forget them, or because I'm one of those who I'll have a question and 10 minutes later when it's time for questions and answers, it's gone. So feel free to write down your questions in the chat, or you can write them down and then ask me later, whichever is easier for you. So 3 things that are required for everybody to heal, for any type of musculoskeletal problem. In order for your body to heal, these 3 things are required. Number 1, you have to have enough water intake, because most of us are about 60 to 75% water. And increasing our fluid intake and staying hydrated keeps your cells active and fully involved, helping decrease inflammation and helping all the body clean out and be normal. So making sure that Susan and I will get, since bilateral for me, work on less painful side that day. Not necessarily, Susan, I will get to that. That'll be the first question we take. So making sure that you are staying hydrated and keeping enough water in your system. Number 2, you need to get enough sleep. Our body regenerates and heals while we sleep. And that's very difficult for some people with sciatica because sometimes laying down is the worst possible position for them and they can't sleep. The third thing is you have to learn what your triggers are. And I use the a mnemonic AMP, A-M-P. What activity, what movement, what position increases your pain? Because if you are continuing to do those things that trigger your pain, I don't care what medications, I don't care who you listen to. If you keep doing this to yourself, taking medications, doing all the right exercises, getting your neck popped, doing everything you need to, but keep on aggravating your problem, it's not going to heal. Or if it does, it's going to take an excessive amount of time to heal. And I use the example a lot of somebody who has a cut on their arm. If that scab covers that cut and you keep scratching it because it itches, that scab is not going to heal very quickly because you know how the scab will peel off, it'll start bleeding again, and you start the whole healing process all over again. Think of that as your sciatic nerve. If that scab is your sciatic nerve, every time you scratch it, every time you take a step too far, every time you move it and irritate it, it's like ripping that scab off and you're wondering, why isn't this sucker healing? It's because you keep on aggravating it and aggravating it and aggravating it over and over. Make sense? All right, and then last thing I wanted to cover before we get to the questions and answers is what should you look for in a healthcare provider? And I look at our bodies as amazingly well-oiled machines. Now, most of us probably take care of our cars way better than we take care of our own physical body. And what I mean by that is you put in the right gasoline to help your car run. You change your oil when it's time to change your oil, or your car is not going to last very long, right? You keep the airs in keep the right amount of air pressure in the tires so that you get the best gas mileage and the best wear on your tires. You get your windshield wipers changed when they start smudging. But how many of us are taking in the best food products, decreasing our processed food intake, eating chemicals that we have no idea what they do to our body? And I'm just as guilty as anybody else. I love food that tastes good, and usually the food that tastes good is usually the stuff that has the most crap in it, unfortunately. And I saw a study the other day, and they were showing, so you people in the UK, this is a pat on the back to you, and people in Europe in general, because they were showing different foods that are produced in the United States, the ingredients for the United States and the ingredients for Europe and specifically the UK. It was amazing the lack of crap that American companies put in the food that gets shipped to the UK because it's not allowed. But all those chemicals, the dyes, the different substances that they put in, I forgot, one of the companies that makes Doritos, there was some things from Hostess, there was things from Kellogg's. I was just like going, and I started feeling bad for my UK friends because they don't really know the good taste of how that's supposed to taste, because all the good stuff is taken out, but it's much more healthy for you. So as a healthcare provider, I look and go, okay, do I want to go to somebody, if you had a specific problem with your car, say in your carburetor, would you take it to a general mechanic who probably had a little bit of carburetor training, but is not a carburetor specialist? Or would you take it to somebody who you know can fix your carburetor? So in the same way with our bodies, and that's why I was comparing it to automobiles, is you want to be able to find somebody who understands sciatica inside out and who doesn't deal with every other problem in the body, because even though they may be great, they may be able to communicate great, they may have a great grasp of sciatica. If they are not somebody who's intimately familiar with sciatica, the issues, and do you really want them treating you? In other words, if you go to a GP and he hands you some medications and says, do this for 2 weeks and come back, like most do, is that somebody you want treating you? The thing is, though, so everybody understands, 80% of sciatica sufferers heal on their own in somewhere from 4 to 6 weeks. And obviously that's not most of you here. And the people who have it severely typically don't spontaneously have it disappear like those 80%. And a lot of times those 80%, it disappears in 6 to 8 weeks the first time they have it. And then 8 months to 2 years later, they get another bout of it that's a little bit more severe, but they still might get over it. And so they sort of think, hey, I could just do what I did before and it's going to go away. And those are the people who typically develop into chronic sufferers because they don't deal with it the right way initially. So just some food for thought. The other things that I have listed down is don't just go to someone who's going to throw medications at you and not really take the time to listen, understand, and get you to somebody who can actually help. One who definitely does not just give you a generic exercise handout without assessing your movement, without showing you on the exercises which ones are good and bad for you. If someone's just handing you exercises, they have no idea how you're going to respond. So I would run from those type of people. And the bottom line is I would seek out somebody who's a sciatica specialist. And most of the time, those are people who deal it, whether a neurologist or a neurosurgeon, and don't let the surgeon scare you. But they usually are dealing with people with sciatica a little bit more frequently. If they're a neurosurgeon who only wants to do injections and give you medications, it may be fine. Try to find somebody else. Or if they basically just say, you have a herniated disc, you have to have surgery because there's no other way. Definitely time to run, because just as I'm not against bracing, I'm not against meds, I'm not against injection, I'm not against surgery, except for the fact that 98% of back pain patients don't have to have surgery. So if you're getting told surgery right away, there's something wrong and somebody's just looking out for their bottom line, because studies have shown that most herniations heal on their own over time. And studies also show that most people over 35 years old have disc bulges and disc degeneration, but no symptoms. So I do have a problem with MRIs, unlike all the other things. I definitely have a problem with MRIs because I think I sent out in the pre-information MRI, the studies of MRIs that I've done. And so many times they have no correlation with people's symptoms. Or they have a bulge and it's like, well, people 50 years old, about 80% of 50-year-olds have bulges in their back and no pain. That does not mean because you have pain that it's the bulge's fault. And I've had so many clients who have had MRI readings come back that say, hey, you've got herniations on the left side of your spine, but all their symptoms are on the right. Irrelevant. The herniation has nothing to do with the right-sided pain, because if the herniation had something to do with it, it would be on the same side, touching the nerve that was irritated. Also, another thing with MRIs, a lot of people are comfortable laying on their back many people are comfortable laying on their back in the position when they're having their MRI. So if their MRI comes back and it says, well, you've got the nerve irritated by this bulge or herniation, you've got all this degeneration, no wonder why you're in pain. It's like, wait a second, I was laying down for this pain-free, and they're telling me that I had a herniation bulging into my nerve, and that's why my pain is in my left leg. But when I was in that position, I had no pain. So to me, I look and go, is that really relevant? Now, if you had an MRI standing up and that's your painful position, maybe, but a lot of times what comes out in an MRI does not correlate. I had a lady who was having issues. She was shown to have 2 herniations in her back at a time she was having abdominal issues, and they said, you should be having leg pain. She goes, I have no leg pain. I've never had back pain in my life. She had 2 significantly large herniations. 2 years later, she started developing leg pain. So what went through her head? Obviously, those herniations are now aggravating my nerve. She went back in for a second MRI to find out how bad it progressed. Herniations were gone. No sign of anything that should be giving her leg pain. And when she told her doctor that, the doctor was like, well, that shouldn't, so you had no pain 2 years ago with the herniations, and now you're having pain without the herniations. And oftentimes that is the case. And my other only problem with MRIs is if you don't have an MRI from before your pain, which nobody really does, except on occasion, like this lady who had the 2 herniations from the stomach issues that they were able to see on the CT scan. If you have nothing to compare what your MRI was before and after your pain, you don't know how long that bulge, herniation, the degeneration, the stenosis, the spondylolisthesis, the spondylosis, whatever you're being diagnosed with, you don't know if that was there before the pain started. So that's just my little rant and my soapbox about MRIs. Not that they're not needed, but most of the time they can often confuse patients because doctors don't tell you that, hey, you know what, after 30 years old, people's discs degenerate. That's just, and people think, oh no, I got arthritis, I got degenerative disc disease, I'm going to have pain the rest of my life. And that's not always the case, and it shouldn't be the case. So what I'm going to do, we've got about 25 minutes for questions and answers, and I'm going to start with the 2 that were asked first. Susan asked, since I have bilateral sciatica, for me, do I work on the less painful side that day? And Susan, the answer is no, because if you are doing any exercise or trying to stretch that leg and you're having issues, I do not allow anybody to exercise when they are having pain while exercising. I mean, you're going to have everybody with sciatica has a certain level of pain. If there's an exercise you're doing that is increasing your pain or increasing any symptoms, you have to stop. So Susan, the thing that I would start with you, if you were a client of mine, is I would want to find where there are imbalances and where you had a side that the side that was looser, more comfortable, less restricted did not aggravate your symptoms. It might be with your arms, it might be with a trunk movement, it might be a side bend, it might be laying on your back, dropping your knees from side to side. There's so many different exercises that you can test for and assess for, but I definitely would avoid exercising either of your legs if you have sciatica going down both legs, especially if when you move the leg, it causes more pain, because otherwise you're just going to be knocking your head against the wall, wondering why it's not calming down. Great question. So Annie on her iPad says, the only time I'm pain-free is flat on my back in bed. Everything else causes pain or pulling down my right leg. So we would have to find exercises that you can do while you're lying on your back. Then after doing your exercises, have you move and stand up and see if you can sit up with less pain, move with less pain. So that can be whether we're moving with your legs, moving with your arms. There's so many different things that you can do from a laying down position to try to calm that down. So typically when someone has pain when they're standing up compared to laying down, it shows that obviously something's being compressed in the back that's causing the symptoms down the leg. So we'd have to work on range of motion and balancing things out as best we can while you're laying down before we try to move into other positions. All right, Janet, I believe it's Janet. I'm not going to call you Jamu again, Janet. Okay, what movements should we do to ascertain what exercise movements we can undertake to aid recovery and stop the pain? Great question. There are a plethora of exercises to do. One simple one is you can just twist your body right side to left side. Actually, you know what? You four people who are on screen with me right now, sit on the edge of whatever you're sitting on, or if you can't sit, stay laying down. While you're sitting, what you can do, just twist to your right side and then twist to your left side. Does everybody feel like one side is easier, looser, or more comfortable than the other? Yes for Anne. Carol? Yes. Janet? Yes. Eileen? Yes. So what I want you to do right now, remember whichever side was easier, more comfortable, nice and slowly, I want you to just turn that direction 10 times. And for those of you who are not on camera, you can watch what we're doing. And what you're going to do is just turn to the more comfortable side nice and slowly 10 times. And then you're going to take a break for about 10 seconds. And you're going to do 10 more to the same exact side. The easier side, the more comfortable side. All right, after the second set of 10, all I want you to do is turn once to the side that was not as comfortable and tell me how it feels now compared to what it did before. A thumbs up means it's you either turned farther or had less pain. Thumbs down means it got worse. Sideways thumbs mean no change. So that got worse, Annie? So 2 more sets of 10 for you to the good side, Annie. Janet, better, good. I don't see your name on the screen. Carol, better, good. Eileen, better. All right, Annie, you just messed it up. 3 out of 4 people got better. All right, go ahead and do 2 more sets of 10, Annie, and then we'll reassess it. Eileen, what I would do, I'm reading your direct message, do the exact opposite side, do the stretches that they gave you for your good side only, not your bad side. Make sense? So basically take I actually had, for those of you who are on my, my sciatica and piriformis syndrome relief group, Facebook group page, the lady who is now a moderator on the page with me, her name is Tina White. She actually took my 8-week, she had been suffering with piriformis syndrome and sciatica for 20 years, was getting injections every 6 months just so she can continue to function. She was going to be going to Las Vegas, Nevada to go get her piriformis muscle removed when I met her. And I said, look, please do not get anything removed ever unless you try everything first. She goes, I've tried everything. I've been going to the chiropractor, going to physical therapist for years. It's 20 years, Dean. I said, just give me a chance. Please, please give me a chance. And so she did. She joined it. At the time I was running 8-week classes. She took an 8-week class. And by the 6 weeks, she's going, I can't believe it. I go, what? She goes, I haven't taken medications for this. And I haven't been to the chiropractor in 3 weeks. That's the first time in 15 years that had happened. And I said, awesome. I said, by week 8, you should be about 90% better. And she was. And to this day, she hasn't gotten an injection. She's taking no medications for that problem. She's got other issues that are going on, but she goes, and I will say it has flared up twice in the last, it's been about 4 years. Once was when she was trying to remove a window unit air conditioner because it strained her, but she did the exercises and was over it within 2 days. And then she did something else crazy like that. And another 2 days later, she was totally fine. So I know that, oh, I'm telling you this story because just like you just asked me, Eileen, what should you do? So she had a shoulder problem and she wrote me and said, Dean, I'm going to go to a physical therapist for this, but I'm going to tell him my problem is in the other shoulder. And I want to see what him working on my good shoulder is going to do for my bad shoulder. And I said, okay. I said, I think that's crazy, but go for it. So she basically faked as if her problem was on, let's say her pain was on her right side. Sorry, and the screen is all backwards. So she told the physical therapist that her pain was on the left side. And as she moved the left side, she was mimicking and telling them what the pain was like when she would try her right side. So she did everything in reverse. And all they did was worked on her good side, which she said was her bad side. And within 2 weeks, her bad side was 100%. And I went, you've got to be kidding me. I said, what did you do when you were done? Did you tell them? She goes, oh, I absolutely told them. I told them about you. I told them about what I did. And they looked at me like I was crazy. And I said, I might be crazy, but you just took care of my right shoulder problem by working all on my left. And thank you. And they never got in contact with me like they had promised. But it's kind of crazy because, hey, I'm a physical therapist. I take pride in my profession. And I'm saddened by the lack of receptibility to the principles that I'm teaching. Although more and more now I'm starting to see online people say, hey, if you've got sciatica, don't stretch your painful side. And I'm going, wow, finally people are starting to come around to see. And what's crazy is when you do this with any other problem in the body, it works in a similar fashion. I used to take my frozen shoulder case patients who couldn't lift their arm past here, and I would literally get underneath them, put my shoulder underneath them and stand up and try to lift it. And literally these people would just put their head down on my other shoulder and just start screaming and crying. And I'd say, I know I'm so sorry, I've got to do this to loosen up the shoulder. We've got to get it unfrozen. And after learning these techniques, now I don't even touch their frozen shoulder. I work their trunk out. I work their legs out. I work the other arm with bands and stretching, and their frozen shoulder melts and unfreezes so much more quickly and with so much less pain. So, Annie, how did that feel going to the bad side after you did the second set of 2 sets of 10?
Not good.
Not good?
No, I felt them down the bad side when I was stretching to the good side.
Okay, that's one thing I should have said. If you're feeling it on, okay, hold on a second. You said you were feeling it on your bad side when you were moving to your good side. Did you test which one feels better, right side or left side?
Left side.
But when you're doing the left side, you still feel the pain?
Yes.
All right. Remember, one of my rules was if you're feeling pain when you're doing exercises.
Sorry?
Do you remember when I said if you feel pain when you're doing any of my exercises, you got to stop right away?
Yeah.
Okay.
Well, I did. I did.
Yeah. Should have stopped. All right.
Yeah.
Now, just for Annie, because that didn't work, what we're going to try is one more exercise. So Annie, take your right ankle and cross it over your left knee. So you're sitting in a figure 4. Everybody can try this as well.
Oh, dear. Oh,
Can't do it with your painful leg?
it's up now. Yes, it's up.
Okay, put it down, Annie. Now what I want you to do, so everybody else, not Annie, everybody lean forward and tell me, or don't tell me, but feel how that feels on your right side. And then you're going to take your left leg and cross it over your right knee, and you're going to lean forward and tell me how that feels. And Annie, I'm assuming doing the left side is going to feel much better than the right side.
Yeah, but I still feel it down the right side.
Say that one more time.
I still feel the pain on my right side.
Okay, is it getting worse when you lean, or is it just the pain's just there?
It's just that horrible pull, like a real tight pull.
Okay, so when you cross your left ankle over your right knee, is that comfortable or is that pulling it too?
That's pulling. Everything, both sides, everything.
All right, so everybody else except Annie, whichever side was more comfortable, I want you to cross the comfortable side over, and I want you to lean nice and slowly 10 times, and then take a break and do 10 more. Annie, what I want from you is, while you're sitting there, I just want you to march in place. What happens when you bring your right knee up and your left knee up? Does your left leg feel much easier than the right side?
Yeah, yes.
Okay, so you get to march 10 times with your left knee up and down, okay? unless it aggravates your right side.
Now that's 6 and it's beginning to pull now again.
Okay, then
6.
stop. All right, we're
Yeah.
going to have you probably do something in a different position. Are you the one who said that you can only lay down?
Yeah.
All right. Lay down on your back.
What?
Yeah, lay down on your back. Take your time. My name is Shaliz. I'll say Gigi. What
Hang on.
do you do when your trigger is standing? Gigi,
Oh,
when your trigger is standing, you've got to try to avoid standing as much as possible, for now at least. Figure out how long you're able to stand before the pain gets aggravated and use that as a barometer, and don't pass that, because some people have pain in sitting, some people pain with standing, some people pain with walking, some people with pain with laying down. So you've got to try to avoid the painful positions as much as humanly possible. So that's my answer to that. So did everybody do the 2 sets of 10 leanings? After you're done, flip the other leg over, lean, and see how it feels now compared to what it did. I lean up, medium. So that's improved. Carol? You're muted. I see the lips moving, but nothing's coming out. Hold on one second.
Oh, there. Is this better?
That's much better. I can hear you.
Okay. Before we started anything, I wasn't hurting, but I've taken a pain pill about 1 o'clock and I wasn't hurting. But when we did all that, now the pain is in my back and all down my right leg. Just by
Okay,
all.
so then we were doing too many things for you at once.
Yeah.
Yeah, so when you started, you probably didn't have pain and you probably were moving in positions that you shouldn't have been because it was masked by the pain.
Yeah.
Masked by the meds. I'm sorry. So you start back at the beginning. Trunk twists. Are you able to do one side without pain, or is it both painful now?
I mean, I'm hurting now and I can do it, but I am hurting my whole lower back and the right leg down to my knee.
These exercises typically work best when people are in more pain, because when you start balancing out imbalances, that's when the pain should come down. Okay. So when you twist to your right and twist to your left, are you able to do one easier than the other without increasing pain?
Yes.
All right. So go to the easier side. 2 sets of 10. Janet, after doing the bending forward, better, or worse? Okay, oops, I just muted you as you unmuted yourself. Go ahead, you can unmute yourself and say it.
Can you hear me now?
I can hear you now, yes.
Yeah, so my back is much better from doing it with my good leg. When I went back to my bad leg, it's still tight, but it's not
Still
as
tight,
painful.
but everything's feeling much better.
Yeah, it was amazing, the difference on my back.
Awesome. Pretty wild, isn't it? So basically, when you find the right exercises to do and the right movements to balance out imbalances, your body's in a better position, number one, to heal. And when you're more balanced, there's less tension, so less pain. So Annie, as you're laying there, go ahead and bend both knees, feet flat on the bed, both knees up. And what you're going to do is you're going to drop your knees from one side to the other and tell me which one feels more comfortable, going right or going left. And guys, I'm not going to be rude, but in 10 minutes, I've got a call with a one-on-one patient. So I am going to have to cut out in 10 more minutes, and I'm going to try to get to everybody's questions.
left side is easier.
Left side is easier. Good. You're going to go to the left side, 2 sets of 10, and I'm going to go next to Dawn. I'm 47 with scoliosis, have always had lumbar pain, but this is the first time I've had sciatica down the leg. I know there are bone spurs on this side. I had an epidural injection over a month ago. Was great until this sciatica pain started yesterday. I don't know where to go from here. It's most painful in standing and walking. All right, Dawn, you are one of those who has to find the imbalances in your body to balance it out. Scoliosis or not, your body will compensate for that. So by balancing out your body, I sound like a broken record, but the more balanced you can get your body, number one, the less pain you're going to be in. Number one, the less tension your body's going to have. Number two, the less pain you're going to be in. And number three, you're putting your body in optimal position to heal. Sorry, I'm trying to keep up with everybody here. Carol, how does that feel now going to the more painful side? Did it calm it down at all?
Not really, to be honest.
Okay, nope. I want you to be honest. When you were doing the exercises to that side that was better, how did that feel? It didn't aggravate the pain more, did it?
No, I could do it. I could do it. Okay.
All right, do another 2 sets of 10 then. My
Okay.
rule of thumb is I keep doing the same exercise over and over again until the progress plateaus or it's even. And if it starts aggravating things more, then I stop and look for something else. Bought a massage gun. Should I be using the massage gun on the good leg, hip, or the bad leg? Good leg. Indeed, the back. And you want to do it on the leg, the opposite side leg and the opposite side back with the massage gun. All right. And Annie, I felt those stretches down my bad side when turning to my good side. That's okay. That was from before.
Yeah, that was before.
Annie, sorry, I didn't see that before. It was way down the list on mine. All right, Susan says, I've been arguing my pain is piriformis, even though they say it's herniations. I cannot tolerate rolling on rump on bed or lay on either side. I lift up with arms to get up. It hurts in bed always. After half an hour up, there's little pain. Susan, that actually sounds more herniations than piriformis, because piriformis syndrome is typically the worst in sitting and usually doesn't hurt as much in laying down. And when you're laying down, your discs have the ability to absorb water, so the herniations enlarge. That's why it's really, really painful for people in the morning. It's either a herniation problem or a bulging problem or an inflammation problem, because when you're laying down and not putting pressure through the spine, your discs absorb water, or the inflammation has a chance to build up because your muscles are not pumping. So finding imbalances for people is the key. All right, Annie, after you did those 10, did you go to the other side to check it?
Still a wee bit of a pull, but not too bad now.
Okay, do it again. Another 2 sets of 10. If it worked, keep doing it. And I'm just going to keep asking you questions because I love your accent.
Yeah, no. Me too.
You too, Janet. I'm going to keep talking to you. That really helped my discomfort in my back. Awesome. Standing and walking is when my pain happens. Any tips for helping when I'm walking? If walking is aggravating it, Janet, what you want to do is try to avoid the distance that causes the pain. Say you can be up and around for 5 minutes, sit down at 4 minutes, or get into a comfortable position in 4 minutes. When you're walking, take a little bit shorter steps, because every time you extend that painful leg, you're pulling on that hamstring, pulling on the sciatic nerve. Okay, so shorter steps will pull it less. And then this is going to sound crazy, but try and walk backwards on occasion and see how that helps. As crazy as that sounds. All right, I think I got to the bottom of the list. All right, Carol, how those feel?
Actually, a little bit better. I
Good.
can say that. Yeah.
Good. If it feels a little bit better, guess what I tell you to do?
Again.
Yes. Very good. All right, guys, I'm going to sign off here in about 3 minutes. But if you guys have any questions, you have my email now. You can message me in Facebook. I do offer people one-on-one video consultations. They're $50. You do get a money-back guarantee if you're not satisfied. And then beyond that, I do have a do-it-yourself online course that basically is the same thing as if you were coming to see me in my clinic 2 times a week for 6 weeks. I have that much information in there. I talk about breathing techniques. I talk about different writing techniques, all that are scientifically based and have had just as good, if not better, results than surgery for people's back pain through studies that I've done. So feel free to reach out. And I'm going to check on you one more time, Annie, just because I have to hear that Irish accent.
Yeah.
Hello. Yes, it's a lot easier now on my right side when I try.
Awesome.
Pick the two
So
legs.
That's the one
Yes.
exercise, if I were you, that I would focus on, laying on your back, working that good side. Okay.
Yes. Yes. Thank you.
All right. You're welcome, Dean. Thank you so much. I learned more taught tonight than consultations I've paid for over the last 6 months. All right. I like that. I learned more tonight than all the consultations I've paid for over the last 6 months.
Agree.
Eileen, can I use that? Awesome. Yes. Copy. I'm pasting that now. I'm going to email myself so I remember what you wrote. Perfect. All right, guys. It has been a pleasure, and I'm hopefully going to be doing some classes here and there in the future. A lot of the stuff I'm going to be covering is the same just because that's just the nature of the business. But if you're interested in working with me one-on-one with a consultation and then going from there, I'd be more than happy to help you out. I have about a 95 to 98% success rate with people who I work with online. And I say that because I've sold about 653 courses, I believe it's been now. And 6 people have asked for their money back. I only gave it to 4 because the other 2 who asked for it never, ever even opened it. And I'm able to see what people look at. So I told them, I said, I'd be happy to give you your money back if you used it, but you didn't use it. And so we can't. So 4 people out of the 600, let's take those 2 out, 651 people who did not get the results that they wanted. So I know everybody's in their mind going, I know I'm one of those 1 to 2% that's not going to happen, but you got to get that stinking thinking out of your mind. Because if doing simple exercises like you just did had a positive effect, just imagine if you had 3, 4, 5 different exercises that can have this same effect over and over and over again, and you do them multiple times a day, how much better you'd be feeling, how much more mobile you'd be, and the better position you're putting your body in to heal. All right. So guys, been a pleasure. I got to jump off because I got to go jump on a call with Bart. All right.
Thank you.
Take care. Thank you. Thank you.
Bye. Thank you.